This video will cover follicular lymphoma. To anchor ourselves, let's notice the season that this scene takes place in, the fall season, and is shown here to anchor us to follicular, since follicular sounds like fall. The first thing we're going to talk about is bone marrow involvement. At the time of presentation, about 30% of patients are estimated to have bone marrow involvement. This is represented by this character here watching the show while drinking his beverage of choice, bone broth. And this bone broth in specific has a concentration of 30%. Follicular lymphoma tends to form paratrabecular lymphoid aggregates in the bone marrow, which is represented by our main characters here with a pair of green trombones. Trombones sounds like trabecular, and since there's a pair of them, that brings us to paratrabecular. The fact that these trombones are green will remind us of lymphoid aggregates. Follicular lymphoma consists of two main cell types, centrocytes and centroblasts. Grading is based on the amount of centroblasts. Grade 1 will have up to 5 per high power field, grade 2 will have 6 to 15 per high power field, and grade 3A will have more than 15. If there are practically no residual centrocytes, then it is graded as 3B. To remind us of centrocytes, our scene main characters are centipedes, which sound like centrocytes. And to remember that follicular lymphoma is graded based on the amount of centroblasts, we have the competition judges giving these centipedes the highest possible grade on their scale, which is a bomb. These bombs will represent centroblasts for obvious reasons. One of the helpful stains that highlight follicular dendritic cells and their meshworks is CD21. In diffuse follicular lymphoma, these meshworks are absent, and therefore this can be used to distinguish it from follicular lymphoma, which should have retained meshworks. CD21 is represented by this Tweety character, which Tweety sounds like 20, and this Tweety is drinking a beer. The fact that it's drinking a 21 plus beverage will remind us that this refers to CD21. Two helpful immunophenotype findings that point to follicular lymphoma are positive BCL6 and positive CD10. BCL6 is represented by our main characters wearing a belt with a buckle that is made of sticks. The buckle represents BCL, and the fact that it's made of sticks represents the number 6. CD10 is represented by this den in the background here that is full of CDs for some reason. Den sounds like CD10, right? Keep in mind that higher grade follicular lymphomas can lose expression of CD10. Follicular lymphoma tends to progress to either high grade or DLBCL. The last thing we'll talk about in this video is the translocation associated with follicular lymphoma, which is 1418. 14 is represented by this large bag of cash here, which truly is a fortune, wouldn't you say? And fortune sounds like 14. 18 is represented by the fruits next to the bag of cash. These guys stay humble even when they have a fortune. These are tangerines, and tangerine sounds like 18, which is what we'll use to remember this translocation. This translocation results in BCL2 rearrangement and therefore BCL2 protein overexpression.